Hi, everyone. I'm Tucker Delaney Wynn, and joining me today is Steve Mangapit, President of Pinnacle Claims Management and Chief Operating Officer of Western Growers. Steve, welcome. Very happy to have you here.
Hi, Tucker. Great to see you. I'm happy to be here.
Awesome. Cool. Well, obviously, Steve, it's no secret that there's a lot of change happening in the world of healthcare. So today, as you know, we're going to be looking ahead into that world and the world of health management to really try to understand how leaders in these spaces can navigate all this change and keep their members and their business healthy. And I know, Steve, you're really uniquely positioned to help us look ahead there, both at Pinnacle and Western Growers. You're leading some incredibly innovative work to help empower companies and their employees to take control of their health journeys. So really excited to chat with you about this today. And of course, I want to just dive right into these meaty subjects. But I think first, can you, Steve, just give us a quick overview of your roles at Pinnacle and Western Growers so that we have some context for your perspective and your background?
Yeah, no, I'd love to. This is a topic near and dear to my heart, and we spent a lot of time talking about this, thinking about this stuff. So it's always a challenge for me to try to convey these complicated issues and challenges in a kind of in plain language. And we spent a lot of energy in trying to solve these problems. So my role, really for both companies, is to be a leader and empower my teams to bring value to our customers. So with Pinnacle as president, I oversee the entire enterprise, and Pinnacle is a healthcare solutions company. Our core business is a third party administrator, and we're administering large self-funded employer plans. We also have a pharmacy benefits management company. So we're managing the prescription drug programs for a lot of the same customers and some other customers as well. And then we have Pinnacle Health Management, which really is aligned with the other two sides of the house, which really is trying to make a difference in the way that health is received by our members and the associated outcomes with that, and of course the cost that goes with those with the care, right? So think about a TPA in the old days was more kind of seen as a transaction processor, and I think the right TPAs and the kind of where the market needs us to be is actually influencing outcomes and kind of the bottom line and the health of not only our clients' employees, but the financial health of their organizations. The nice parallel is our sister company, Western Growers Health, which is a health plan. So a lot of the same nuts and bolts transactional type work operating like an insurance company. But we represent a health plan for companies in agriculture, and I am a fiduciary managing the risk of that plan. So whereas in Pinnacle, we are working and the trusted advisor and administrator for our clients' money. On the other side of the house with Western Growers, I'm managing the trust assets that I'm responsible for. So a lot of times when I'm looking at like opportunities for improvement and enhancements and bringing value, I can come to our customers and say, when I'm writing the checks and it's kind of our money on the line, these are the things I'm doing, and this is how it might work for you. And a lot of those efficiencies can apply across industries. Some of the stuff we do on the Western grower side is more unique to the populations we serve, but there's a lot of commonality across industries. When you talk about healthcare, we're all human beings and we all need healthcare. And we're all, by and large, we're serving clients in the United States and predominantly more on the West. So there's a lot of things that we can do on both sides of the house and gain efficiencies and kind of have learnings from different sides.
I love it. Thank you, Steve. And it's so helpful, I think, to really get that context where you've, like you said, you've got both sides of the house and you kind of have perspectives that I think feed into each other and can kind of help each side as you work on that. So thanks for that. And definitely you touched on a number of things that I'm excited to get into, especially with health management. So yeah, we're going to get into all of it. I think to start, Steve, I'd love to zoom out and really talk big picture. I know you think a lot about the state of the healthcare industry and where we're headed, and there's a lot changing right now. And I already know that both Pinnacle and Western Growers are digging into some very creative solutions, but I do think it's worth articulating a few of the larger kind of problems and challenges that the industry is facing right now, just to kind of contextualize all the solutions that we're going to talk about. So I've heard you talk about things like rising costs, access to data. I'd love to just begin, Steve, by having you share what you see as some of the biggest challenges facing, especially employers who are responsible for the health of their employees.
Yeah, I think it kind of, the story starts and the story ends with cost, because cost influences a lot of the other variables that are factoring into this. And it's a very cyclical type of thing. Like, is it the conditions that are driving the cost up, or is it the cost that's driving the conditions and exacerbating the problems? And I think the answer is probably a little bit of both. But I think if you really kind of zoom super far out, we have an inflation problem in healthcare. We've had for many years, and we have an affordability and an access problem. That is driving up costs. And then what you also have is a little bit of the population health management within the United States. If you look at the number of people that are diabetic or pre-diabetic in our country, it is astronomical. Um, so we have more comorbidities today than we've ever had, despite all the advances in medicine and science and technology. Our populations are very unhealthy, and they're getting older. So that also is influencing the potential cost that the employers or whoever's paying for these claims is going to incur. Um, some of the bigger companies that are managing the reinsurance layer, so ultimately the people that are kind of doing the math and the actuarial work on, okay, what is this going to cost? It's fascinating because usually they just look at things like demographics and network and things like that. But I think this year is the first year where people like me are seeing the people that are carrying the risk and the financial instruments start speaking to population health, like obesity and lifestyle. So it's kind of bringing things back into the conversation that some of the players in this space have kind of poo-pooed over the years. Like wellness is one of those things, right? So getting people healthier on the front end and preventing conditions from ever manifesting is really got to be part of the solution here. And when you look at investments that employers and health plans have been making over years, that has always been an area that's got a lot of scrutiny because it's really difficult to measure ROI. But now we're seeing the people that are carrying the paper or the finances are crying uncle. Like, we have to do something about the underlying health of the populations here. So I think we talk about the problem of cost skyrocketing. Um, we have to look at solutions that are not just short-term fixes. So I spent a lot of time talking about this when we're kind of talking to brokers, consultants, or customers. Like, so a lot of the short-term thinking historically has been, okay, costs are going up, the employers can't absorb all of it. Let's shift the cost to the employees. And that's usually in the form of taking more out of their paycheck or making their benefits less rich, so the employees are paying more. And that could be in the form of raising the deductibles or raising the out-of-pockets. Making the insurance less usable, if you will. So that all either is directly or indirectly shifting the cost to the employees. And I would argue, yes, that is a short-term infusion of cash for the employer. But what happens is if you make healthcare more unaffordable for your employees, they're not going to use it. And then when they don't use it, then all of these underlying health conditions become a higher risk profile. And then you're going to have more prevalence of bigger, more catastrophic type illnesses that are going to drive big hospital bills. And that's going to feed into your insurance prices going up even further. And then you kind of get caught in this loop of costs keep going up, you need to shift more to the employees. They're going to use it even less, and things are going to get even worse. So that's kind of this wicked spiral that'll keep happening unless we find a different way to do it. So I think that's a lot of the challenge here. And if I we spend a lot of time thinking about strategy and how we can help our clients. One of the other interesting things that I've kind of come to the real revelation on is we have this interesting situation with technology these days. So today, with all of the technology and the capabilities to integrate, I can have data going lots of different places. I can have things, they call them APIs and real-time connections. So we can integrate with lots of different partners to work together to solve the problem. So it's easier to connect with everybody. But the reality in the business environment is a lot of these players in the space are out to make profits, right? They're all for-profit enterprises. So there's more walls going up and less connectivity more now than ever. Everybody wants to be the gateway or the portal and hoard all the data and then control the solutions around it. Everybody wants to be the hub and not a spoke. And what happens is that it's to the detriment of the system working together well. And you've got all these actors that are chasing profits that are sometimes run into conflict with each other. So it's another interesting challenge. And that manifests in like insurance companies owning providers, or PBMs owning pharmacies, or PBMs starting to make their own biosimilars and things like that. They're trying to chase the almighty dollar, which makes it harder for efficiency to be driven down to the benefit plan and ultimately to the employer or the member.
Yeah. Wow. Okay. So you just laid out, I think, the matrix of challenges, and this is great because I think you've given us so much fodder, and there's so many ways I'd like to take this. But so thank you, number one, for that. I think what I'm hearing, Steve, on the one hand, is really a lack of focus on long-term health management that's really hurting the industry and ultimately hurting employees. So huge problem there. The ways that technology are used, sometimes good, but sometimes that feeds into a profit motive that again really hurts the industry and ultimately employees. Um, and then hoarding the data too, and that being a really problematic situation. So I want to tap into all three of these. And what I might do, Steve, is I might ask you just kind of explain what you see as a solution, and in some cases, if you want, even maybe a couple tips that an employer might want to think about in order to start addressing that. So yeah, we can kind of get into it a little bit. I wonder, perhaps starting with hoard the data, because I know we've talked about this briefly before, but you've mentioned how employers are often, they have a fiduciary responsibility to help their employees. And the issue, though, is that sometimes you've mentioned they don't always have the access to the data. So it's kind of hard to do justice to their employees if they don't have that access. So it's kind of a complex one, though. Can you kind of summarize that challenge overall, Steve, and then talk through how you think employers could start to address or take some solutions there?
Yeah, it's I'm not a fiduciary liability attorney by any means, but plan sponsors typically have a fiduciary responsibility. So they're making decisions on behalf of the plan, and they have to make decisions that are completely for the benefit of the participants of the plan. And if you think about just kind of like being responsible for making the right decision, uh, you would need to have the information necessary to make the right decision. So when you start talking about things like which insurance company should I use, or what type of plan design should I have, or should I use this PBM or that PBM? Should I be self-insured or fully insured? All those questions, um, if you really dive in and you want to have a very thorough analysis so that you can make the best informed decision, you need more information, um, and you need data. And we spend a lot of time in our world talking about data, and it is a very difficult thing to explain and manage. And I often like chuckle when I look at the uneducated buyer. It's like, well, we got all these reports, like we're getting all our data, and it's like, well, how much of it is actionable? Like how much of it is meaningful? Um, I know, like, from the early days in my career, I spent a lot of time in front of CFOs, and the CFOs often have the "so what" question. It's like, okay, we just went through 20 minutes of you showing us reports. So what? What does it mean? What can I do about it? And that's the right mindset, and that's the right type of curiosity that a fiduciary should have. And I would argue that everyone has options. um, even in markets that are like dominated by like a one carrier, and a lot of people think I have to offer this carrier, it's the only option available. There's still options. There's a lot of unique things that companies like Pinnacle does, to help bring more value to the participants, bring more efficiency into the programs. So when we talk about data, largely talking about claims data. So the participants on the plan, what services are they getting? What were they being treated for? So you're talking about procedures and diagnoses. Where are they going? How much are you paying? What are the discounts that you're getting? It's really critical information, and the incentives in the system are to not give the employers the data, because that essentially allows someone to go shopping for a better deal, right? So if I if I get the data from a client, I can more articulately show them what the opportunity for something better is. If I don't have any data, I'm just kind of doing the sales thing and saying, on average, we can save you this much money, or we suspect that something inefficient is going on here, but we don't have any data. So I would challenge I would challenge everybody to push hard, and work with a good broker consultant, because they will be the ones fighting for you for that data. And there's a whole world of statistical credibility and sample sizes and things like that. And the smaller the employers are, the more the data is in pools and things like that. And the mathematician in me says, yeah, you can't extrapolate the future on a group that only has 5 people in it. That's why things are in risk pools, and that's largely to your benefit in the long run. um, but I really think, the what we call the middle market, your 100 employees and up, you really need the data, and you deserve the data. And I think that's where you and your broker really have to push.
Yeah, really becoming, I love that. Really becoming, helping employers realize that they need to be advocates themselves for the data and push for it and get it. And then it sounds like also find partners who can not only answer the so what, but come to you with the so what and kind of make that immediately apparent.
Yeah,
Yeah,
and I mean, I'm a data wonk. And when we talk about like data and analytics, there's there's different layers of maturity, and I think about that a lot, right? There's descriptive analytics, which is telling you what happened, and it might dive into a little bit of why it happened, right? And then there's predictive analytics, where you can look at the data and say, this is what the data is telling me is going to happen in the future. Um, where we want to be is in the prescriptive analytics that tell us, here's what the data is telling us we should be doing to get to the future that we want to achieve, right? Because descriptive is your rear view mirror, predictive is just where you're headed. That doesn't feel super actionable on the surface, and it's kind of like a little handcuffed to, we're on this road and we don't like it, right? But prescriptive analytics is where we can say, okay, here's what we can do to get on the right path. Here's how we can use data to shape strategy and then execute on that strategy to get to where we want to go.
prescriptive analytics. I love that. Yeah, that makes total sense and yeah, feels much more actionable. So yeah, that's really cool. Also, well, feels like prescription tie into like RX and kind of stuff. So that's
Oh yeah,
really nice.
that's not a coincidence.
I love that. Is that a Steve Mangapit coined term or
Oh, no, no, no. This
no?
is
That's
a
industry
this is a
wide.
legitimate kind of maturity of analytics.
Cool. So prescriptive analytics, that's a great solution. I think awesome to have that and to have that kind of so what mindset, as you were saying as well, Steve. I would be remiss, there's a couple things I want to circle back to that you talked about earlier, Steve. And one of them was that I think you described it as a wicked spiral of what happens when profit motives get in the way, when short-term thinking goes in the way. I know that you have a different phrase for kind of the opposite of that wicked spiral that is near and dear to your heart, and I think you've already
Yeah.
kind of articulated, you've articulated kind of the what the bad version of that looks like. I'd love for you to explain the good version, and really why it matters and what it means for health management.
Yeah, so the wicked spiral, if you will, often might be described as a vicious cycle, right? So one bad thing leads to another bad thing, and then it just keeps spiraling on itself, and kind of like the negativity or the downstream effects compound upon each other, right? So the opposite is called a virtuous cycle. It's when a good thing leads to another good thing, and it's kind of like sometimes I think about like the guy in front of me in Starbucks that buys my coffee, and then I buy the coffee for the woman behind me, right? So goodness and good deeds can lead to more good things. So when we think about how do we impact what's going on in healthcare, there are some virtuous cycles in there, you can, a virtuous cycle, you can really enter into this cycle anywhere in the circle, if you will, right? You don't have to find the right place to get started, you just have to get started. So when I think about like employer sponsored healthcare, a virtuous cycle might look like an employer investing in health and wellness programs and preventive medicine for their employees, or it might look like bringing in benefits with no copays available, so it's easier to access care. So when your employees have better access or more affordable access to healthcare, they're going to get treatment that they might not have otherwise received. That preventive medicine will lead to less absenteeism from work, maybe more just general happiness of the employees. They're not as sick. Your physical health can lead to better mental health, can lead to better performance at work. But that better health state of your employees can also manifest in less catastrophic claims down the road. Maybe your person who was on the road to be diabetic now got off that off ramp, and now they're not going to be diabetic anymore, and they're going to have a more productive life for them and their families, but also less catastrophic claims that are costing your health plan more money. And when you're as the employer, you have less catastrophic claims. If you're an insured plan, that's going to manifest in better renewals, like lower prices on your renewals or smaller increases. And if you're in self-insured plan, all those claims that didn't happen are direct savings into the pocket of the plan, and that can be returned to the employees in the form of maybe less increases on their payroll deduction next year, or more benefits, or maybe it could manifest in the employer maybe hiring more people, or providing raises, or maybe not doing as many layoffs, or whatever it may be. And then that economic success of the plan representing itself to the employer and to the employees, that also can be returned in the form of reinvestment into that health plan. But even if your employees are just maybe getting less money taken out of their paycheck next year, maybe you're preventing some food insecurity, and they can continue to eat healthier foods and things like that. Or maybe they just have more prosperity and they can reinvest in their families and be happier and healthier, and then the cycle continues. So there's a lot of great things that can happen if you can kind of catch the train going in a virtuous cycle as a health plan.
I love it. I think it's such a great framework, and makes total sense. And your analogy of being in the line at Starbucks and helping everyone else is great there. And yeah, and again, I think it ties back to that perspective of that really long-term view, long-term ROI, long-term health. So it's awesome. It does strike me, Steve, that something that's really key to the virtuous cycle that almost kind of powers a big part of it is member engagement and making sure that your members are actually engaged, utilizing their healthcare benefits in order to make the whole thing run. I know that's a subject that's near and dear to your heart, and I'm sure there's a lot of employers out there that are trying to figure out how they can start to really generate a little more member engagement. I wonder if you have any tips that you might give to employers that are looking to jumpstart or boost member engagement and wondering, how should I get started?
Yeah, it's a really really tough challenge, Tucker. And usually when I think about member engagement, I don't try to prescribe a solution to every customer. I don't think it's a one size fits all solution. And I would frankly talk to the leaders at the employer. Like, these are your employees. You have to communicate with them all the time. Like, how do you reach them? How do you drive engagement? And when I think about engagement, it's more of like active listening and understanding of your messaging that you're trying to deliver to them, right? So um, when I think about engagement, some employers have like an intranet. Some of them, they, in the old days, I'm aging myself a little bit. They would put a little flyer maybe in their paycheck when they hand it to them, right? Um, Most people have direct deposit these days, so that's not really the 2026 solution. But is it email? Is it texting? I know some employers, they have a Facebook channel for their employees, or some employers are using WhatsApp, or more of like an online type of tool. Um, some employers have like in-person town hall meetings where they're communicating with their employees. So really really working with the employer first and foremost, and having that conversation of what is going to work, right? They're going to have a lot of insights on what's going to work. And then bringing our expertise, or bringing in experts like Pinnacle or Western Growers, say, here's what we've done, here's some best practices in the past. I know um, i know the lessons I've learned is, email is tough. I think phone calls is nearly impossible these days. I don't know about you, Tucker, but if I see a phone number calling me, I'm usually not answering the call, right? So the idea of cold calling someone and getting them to engage with our health plan is a pretty tall order. We find text messaging is still working quite a bit, and we find physical and in person is standing out a little bit better today than digital. Digital is cheap, and you can drive a lot of messaging out there, but there's so much noise today in the digital space. It's really hard. So like, we used to offer Amazon gift cards to people for engaging in our programs. And then I think one day somebody figured out it's cheaper to send them a digital gift card than to send them like the piece of plastic, right? But that actually gets a lot more likely to get lost in the shuffle. Um, and I know I said it half joking to my team, but I think there's some truth in the idea that a piece of broccoli is going to drive more engagement than an Amazon gift card. And people look at me like, what are you talking about? So what we did, for example, in one of our health management programs, is people with chronic conditions, we're bringing them, dropped to their doorstep, um, boxes of fresh produce, fruits, veggies, things like that. That has a direct connection to their treatment of their disease state or their condition. It also is just practically really hard to ignore a giant box of fruits and veggies on your doorstep, right? So we will get your attention one way or the other. And then what we've learned is the interesting side effect is it gets the whole family involved, the whole household, right? And I'm doing it myself, opening the box with my kids, like, this is cool. What's this? Let's figure out how to cook it. Let's figure out how to eat it. Um, and now that we're kind of on a weekly delivery, my kids are like, Dad, is the box coming tomorrow? What do you think's going to be in the box? And you know, children getting interested in fruits and veggies instead of TV and candy is music to every mom and dad's ears, and that's going to drive engagement with our plan, because I know my wife would be saying to me, I don't know why we're getting these boxes, but you better make sure we keep getting them, right? So I think engagement physical is driving a lot of success for us. It's more expensive, but these are the type of investments as a health plan on the Western grower side where I'm managing the risk, where it just makes more sense. And it's short term expense for long term rewards, and we have the luxury of being able to make those bets, and they keep paying off for us. The other thing that we seem to find working is in person engagement. So we'll do the calls, we'll do the texts, we'll do the emails, we'll do the physical deliveries and things like that. But we found if I bring my team to the employer's location, to their work site, and maybe I bring a couple of my clinicians, we start measuring health indexes, taking people's blood pressures, calculating BMI for them. They can meet the team that they would be working with, so the actual people that might be on the other end of that phone call. um, that creates a sense of familiarity and trust, and that's going to pay dividends in making those phone calls and emails and text like reach better in the long run.
Awesome. Yeah. So many great things there, Steve. I mean, what I hear you saying at the end is there's almost a certain boots on the ground element, meeting people where they are in person and forging those connections first. And then, as you're saying, maybe then when you do the digital, connections, that makes it a little more likely that might happen.
Yep.
But I love the creative ways of thinking that broccoli might have more of an impact. I'm definitely one of those parents trying to get my kid more interested in the fruits and veggies, so that resonates with me. So I love those really interesting creative approaches to member engagement, and it sounds like that's been having a huge kind of impact on the Western grower side. I do want to kind of follow that up, Steve, with one thing that you mentioned having the luxury to make a bet like that or to take a risk, and I think some folks who might hear some of these things might be like, "This sounds great. Our financial belt's a little tighter, or I'm not sure I could get my bosses or my board on board with this sort of thing, or we can't do this overnight." So for people who might have some pushback or feel uncertain or not even sure where to start, what's kind of your advice to employers who might be interested in taking some more creative approaches to member engagement, but maybe aren't sure how to start or might feel overwhelmed by trying to do it all?
Yeah, it's a good question, and I think every organization has different decision making processes. So I would start with no surprise here, Tucker. I would start with data. Okay, so when I'm talking to strategizing with a broker consultant, right, and we're looking at a client, let's say, um, one of the things that's not usually data that's presented in the buying process for health insurance that I'm fascinated with is what's the average tenure of your employees, right? How long are they going to work here? Um, and and I would argue if you've got a 20-year-old that's going to work there for the next 30 years or 40 years, and he's going to be on your health plan, you're paying the bills for the next 40 years on this guy. Yeah, maybe investing in health in the long run is a really good idea, right? Um, it's less compelling of an argument if your turnover is like every year and you have new people and new staff and things like that. But if you have a very long-term mindset with your workforce, it makes a lot of sense to invest in them for the long term, and that is in health. And it's not just the medical claims that you're going to be paying for the next 40 years, but if you get that person healthy and productive, they're going to be a more healthy, productive employee for the next 40 years, right? So I think that there's a lot of synergy around that, right? And having an environment where you treat your employees like you care about them in the long run, it's probably going to also be one of those virtuous cycles where, yeah, maybe these people that are really talented are going to want to stick around for 40 years because you actually care about them, right? Um, so I think there's an element of that. I would start there. Um, and then I would, as a guy with a lot of background in finance myself, what I would do is partner with us with a really good broker consultant and look at what are some short term things we can be doing to help pay for these things, right? So when I look at a lot of what we're trying to do, where I'm managing the risk and it's my checkbook that the money's coming from, I can introduce efficiency here to pay for something over here, right? So not everything we're doing is a long-term ROI. There's so many opportunities for short-term efficiency, and I think you can use that to build for the future. So you can kind of reinvest in it. I saw this really cool thing somewhere, one of the socials the other day, and they're talking about cinder blocks. Have you heard this one?
I don't think so.
Okay, so this might even be true. I don't know. The history of the cinder block, right? For construction, right? It started as just a giant block of concrete. Okay, and the problem is a giant block of concrete was really, really heavy, and it became impractical to carry it to a construction site. So the guy who invented the cinder block couldn't sell any of the cinder blocks. So then he said, okay, we got to solve this weight problem. So they started carving out the concrete in the middle of the cinder block. And then it became what we know as a cinder block today, that kind of H shape with the two holes, right? Now it's a lot less heavy and it's more practical to ship it to a construction site. Here's the cool part. By taking that stuff out in the middle, that was essentially wasted resources. And a cinder block, if you ask an engineer, by having that space in the middle with the H shape, it is actually stronger than the solid block of concrete. So I've taken waste out of it. I've made it stronger and more supportive of this project we're doing. And now I have more concrete to make more cinder blocks, right? So I've been thinking about this ever since I saw this thing the other day. That's what we're trying to do. So the short-term thing is, let's bring some efficiency into what we're doing right now, and that'll help us build more stuff to build a stronger foundation for the future. And we can scale higher, make bigger buildings, whatever, right? So some of those things we do, like if I look at a health plan today, right? Let's say I want to create some savings to help pay for some long-term investments. I might look at, what are we doing on out-of-network claims? What are we doing on drugs, prescription drug programs? What are we doing on prescription drug programs that are running through the medical plan? We call them J codes, right? Like infusions and things like that. I can almost guarantee any customer, we can find some level of inefficiency to create some savings for the program without it coming out of the pocket of your employees. Like, I would say 99 times out of 100, there's a way for us to find that cement in that cinder block, and we can dig it out to bring efficiency, make the program stronger, and then give you more resources to build even more, right? That's kind of the sad state of affairs. On one hand, is there's so much waste and inefficiency. It's almost easy for an innovative broker consultant and a good solution provider like us to find ways to bring value to the employer, right? So a lot of low hanging fruit. And I would say, you need the cash back into your organization. Yeah, let's return some relief economically to your organization, but park some of that into reinvesting into your employees for the future.
Wow, fascinating. I mean, one, didn't know the cinder block origin, which is very fascinating. And two, I love that application to health management and what you guys are doing, because I think that's so important, because we're talking here a lot about long-term investment and long-term ROI, and someone might just start to think, well, is all this long-term? But you're saying, no, there's so many things you can do in the short term to immediately carve out, remove inefficiencies, and then not only remove inefficiencies, but use that short-term efficiency to help build long-term ROI. So I love that. Wow, I'm going to be thinking about that one for a while. Very cool. So Steve, I know we're kind of rounding out here. I do want to get to a couple very creative ways you've started to visualize some of the challenges and solutions in healthcare. But before I do that, I thought it'd be good to touch on maybe one industry specifically that I know you have a lot of background and experience with, and have been thinking a lot lately, which is healthcare systems and hospital networks. And that's one industry that I know is facing some really tough challenges, and I think someone, not in that space might think, well, it's hospitals are kind of the epicenter of healthcare. They should have great health benefits, but sometimes there are really some challenges. And I know you have this theory of kind of a zero sum game that many healthcare systems are stuck in. So I'd love to kind of pivot us there a little bit and localize into the hospital and healthcare system area. Maybe can you explain, Steve, kind of what the zero sum game is, and then kind of part B, what are some ways that healthcare systems might be able to free themselves from this zero sum game?
Yeah, it's I have a lot of experience working with healthcare systems, and more specifically their employer sponsored plans. But we've spent a lot of energy, and we were helping some of our larger healthcare clients actually explore direct to employer programs, like bringing more revenue back into their systems. But um, when you think about a benefit program in particular for a hospital or a healthcare system, uh, they have a lot of the same goals, the same objectives, and the same challenges as any employer when it comes to their benefit spend. Right? You have employee relations, and you have trying to bring value to those employees, but then you have the expense of doing that, right? And balancing the expense versus the value you're creating for your employees is a challenge. What's unique in that vertical in particular is the hospital or the healthcare system is a supplier in that space as well. So what you can do is you can eliminate that tug of war between cost to the company and value to the employees, and you can insert in incentive programs to drive utilizations to your own health system, and that will drive revenue essentially back into your own pocket on that spend that was going out the door before. And then what you can do is eliminate that tug of war by giving the incentives aligned to your employees so that they win also when they come into your health system. And that would be typically in the form of like waiving cost share, right? So if you come in and you get treated at our hospital, you don't have to pay anything at all. Um, and then we're essentially, when we're spending the money on the benefit plan, we're just kind of taking it from one pocket and putting it into another. Um, it sounds easy enough, but my experience in this space is people are not active consumers of healthcare. Despite everything that's happened in the last couple of years, I think it's still largely not true. So if I think about how does somebody end up at a hospital, you're not going on Yelp, Tucker, to look for a hospital, right? You're typically you're going to an emergency room and you're just looking at okay, either I went to the one closest to my house or an ambulance took me somewhere, or you have a specialist telling you, okay, hey Tucker, we're gonna do something, and you're gonna meet us at hospital X next Thursday, right? Or maybe 5 Thursdays from now, who knows, right? um, but so if you think about, you're either coming in through the ER, or are you coming in through a specialist telling you to go there? So when you think about how to help hospitals and health systems drive more utilization back into their own system, it starts with primary care and specialty care. And that's where I think it gets harder to administer, and you have to be more thoughtful and strategic. But if you can really get into getting someone to the right PCP and then to the right specialist, and you already have alignment with the specialist to get the people treated at the hospital you want to get them to, you're going to have much more success and a lot less friction. I've seen plenty of plan designs where you kind of make it more draconian. um, that becomes very disruptive to your employees. The other thing we've had a lot of success doing as well is inserting care navigation and having very concierge level type support for people, so they can get the information they need to make the right choices. And then it goes back to the engagement question. How do I get people to engage? How do I get them to understand, use the concierge that we're providing, go to these doctors? It'll be better for you financially, but it also will ultimately allow us to provide better care for you, right? Um, that's where that's where I think the secret sauce is made, and kind of eliminating the zero sum game is in engagement, and then managing your physician networks, and kind of getting that alignment with the incentives and the navigation.
Fascinating. Yeah, thanks for just taking us through, because as you explain the nuances, you kind of unpack the just different roadblocks and complexities that wouldn't be immediately apparent, but then you start to see it and you're like, ooh. So it sounds really like, especially as you're saying, driving that alignment across different parts of the organization to make smoother paths and creating those incentives are really important. Awesome. Really cool. I think maybe, Steve, we'll touch, if you're comfortable touching on the ag industry very quickly, then we can look at some memes, because I know you've got so many different industries that you're well versed in, and I do know that agriculture is a big one as well, especially on the Western growers side. Um, and they've got their own set of challenges, especially in California, that I know you and your team are thinking about. I'd love to hear, I think maybe to start, just what you see as some of the major challenges facing the agriculture industry. And then certainly if you wanted to follow up with any kind of solutions or positive outlooks that you see kind of following that.
Yeah, the first of all, God bless the agriculture industry. One of the most critical industries in our country, and providing fresh food to the world is a really important thing. And I love supporting this industry. Um, they face a lot of challenges that I can't even begin to imagine. But if I'm focusing on healthcare in particular, we have a transient workforce, we have a low educated workforce, and we have a largely non-English speaking workforce. There's also some cultural sensitivity that's required in order to drive engagement with healthcare. Um, those are difficult things to tackle, and it takes a lot of energy and effort, and you have to be in non metro areas, so you kind of run into like a efficiency problem, right? Because it's not unusual for some of the areas where they have a lot of agriculture to not have all of the providers that you might need in the area. Um, really good example. We were looking at one the other day, and we want to drive efficiency, and I think about something like labs or images. So we know we know very well that a hospital is the most expensive place to do labs or to do imaging. A freestanding lab or a freestanding imaging center is going to cost the plan less money. So it's not unusual for a health plan to put in the benefit plan design that if you go to a freestanding place, the members' cost share will be lower, right? And that's to incentivize them to go to a more efficient side of care. What happens is if you live in a very rural area, there is no freestanding imaging facility, and now you've disproportionately disadvantaged the people there locally by not having a lower cost option for them to get their images. So the very people that probably need the most help and the most benefit, who already have low engagement, you know, let's say we finally break through and get the engagement, and then it's like, well, you can get this cheaper thing, but it's 50 miles away. That is going to kill off any future engagement and then make it really difficult to make a difference in these people's lives. So you have to be sensitive around that. And we spent a lot of energy kind of not only being culturally sensitive, but also geographically aligned, and kind of being more inventive and creative about how we can tailor what we're doing to be more successful and drive better outcomes for people, right? And if that comes at the cost of some percentage of what I would call leakage to a less efficient side of care, we would look at the situation in the aggregate to see if it's better for more people, right? The other things we're doing to support the ag industry is really finding a way to be more welcoming and encouraging for our engagement, right? So we last year we kind of did a full revamp when we moved one of our nearside clinics, and we have 4 nearside clinics in California for agriculture. And one of the things we did is like we said, we want our clinic to be really nice. We want it to be state of the art. Like, the standard that I always use is this a place that I would want to take my family to? is this good enough for my family? Then it's good enough, right? And as we're building out this state-of-the-art facility for ag, we have to balance that with, it has to be welcoming to our folks. And having a team of expertise here and having a lot of people that know our membership and our populations really well gives me and our teams the insights we need to really kind of create that welcoming environment. And sometimes it's something as simple as, think about like a beautiful, pristine clinic. I got a lot of people in ag coming in with dirty boots. We just need a boot scrubber by the front door. Not having the boot scrubber makes them feel uncomfortable bringing their dirty shoes. They don't want to dirty our clinic. They care about it. They're uncomfortable. Giving them that boot scraper makes it more comfortable for them to come in, right? And then they can get the quality service that they need, that they deserve, right? So I think a lot of it's around those lines. And then, we talk a lot about, meeting people where they are. And that could be a physical, geographical thing. It could be a psychological thing, or, and, I think 2025, 2026 today, it's not the golden rule. The golden rule is old. It's bad. It's the platinum rule, right? We're treating people how they want to be treated, not how we want to be treated, right? So getting in the mindset of who our customers are and being more approachable, more relatable, and that's what we have to do. And sometimes it becomes very fascinating stuff. I've looked at some things we do. It's like, this is really slick and polished and very highbrow language. Like, that's not for us. That's not what we want to do. We need to have language that's easy to understand, that's accessible by our populations. And then, something like, if you think about like a large Spanish speaking population, one of the things that we did in my early days here is, like I said, I don't want things translated in Spanish. I want things written in Spanish. Those are two very different ideas, right? So I want things written for our audience, not translated for our audience, and that's made a difference as well. And those kind of things, I think, people notice, and they just feel a little bit more appreciation for the time and the care you put into it. And all the little things add up to becoming more relatable and more accessible, and that's going to help accumulate to that better engagement.
Wow, that's awesome. I think just hearing the level of thought that you guys put into it is pretty cool, pretty amazing. I mean, just from a boot scraper to yeah, 100% as well. Writing actually in Spanish, not just Google Translate the document, but really taking those steps to be culturally sensitive, as you said, and geographically sensitive to folks in the rural community. So yeah, that's really helpful to get a deeper understanding of how you guys think about that. Awesome. Well, Steve, this is cool. I know we're coming up on the end, but you just mentioned being relatable too, and I think there's a whole other side of relatability that you do sometimes, which is sharing some interesting memes that I think on the surface are funny, but also speak to some really deep truths about the state of the industry. So with our last few minutes, I'd love to just look at a couple of these with you, and you could just walk us through, explain what we're looking at, why it matters. There we go. All right, so talk to us, Steve. What are we looking at here?
Well, first of all, I'm running a risk here, right? So if you have to explain the joke, then the joke's not that good, right? But this is Rick and his son from Pawn Stars, I believe, from my hometown of Las Vegas. And I think we've all seen this show, and it's the pawn shop, right? And people bring their stuff in, and they always bring an expert and kind of give the history of the thing, and then they decide if it was real or fake. And then Rick ultimately says, "Here's the best I can do, man. Sorry," right? So this one is the client coming in saying, "It's our plan, it's our data." So this goes back to the client as a fiduciary on their plan, and they need that data, and they're the one paying the claim, they're paying the bills, it's their data. and Rick is playing the role of the carrier. He's saying the best I can do is 2 stale reports with no actionable data. So this is pretty typical, um, especially as you get into like the smaller employer space. It's like, okay, I want reports, and it's like, okay, here's some reports, and then the client's like, oh, no, 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 I wanted reports that actually I can do something with, right? Um, and it goes back to the carrier's strategy of bogarting that data, really, so that they make it more difficult for the client to leave, right? And this is especially true for clients that are looking at potentially going self-funding with somebody like Pinnacle. You cannot get uh, typically you can't get a good reinsurance coverage without some data, because the persons that are taking on the risk need to understand the risk they're potentially taking on, right? So the way it generally works in our space is the more unknown, the more uncertainty, that comes at a cost, because the people that are taking the risk, they have to bake in more uncertainty, which makes the prices higher, right? So really the client's not getting the best deal they can if they are not getting their data, right? So this there's a lot of truth in comedy, and this is something that a lot of brokers and clients can really kind of relate to, I think.
Absolutely. I love it, and thanks for breaking it down. Yeah, and I think it goes back to, as you were saying earlier in our conversation, that I think this is kind of the need to push and advocate for the data and get it in your hands and take action, and then be like, okay, this report, so what? Get really be able to take action. So that's great. We got one more here, Steve, from a show near and dear to my heart. But yeah, do you want to break down this one for us?
Yeah, Community, great show, 7 seasons in a movie, right? And Donald Glover turned into like Childish Gambino and movies, like awesome, awesome show. One of my favorites. So this was uh this was an episode, I think, with like multiple endings or something like that. It was
Like
kind
The
of weird.
Darkest Timeline, I think.
Yeah,
Yes,
yeah.
yes, I
Um,
remember, yeah.
yeah, I love the show. So uh Donald Glover's, I think his name was Troy, is walking into the party with some pizzas, and he's thinking he's dressed up, he's coming to a party to have a good time, and he walks in to this like hot mess, right? So clients like, okay, we're trying to control our benefits. Let me get in the room and figure it out. And he walks into this pandemonium and chaos, and it's represented by obesity-related illness, pharmaceutical industry, hospitals, and then the bukas is what we call the big insurance carriers. So that just means the Blue Crosses, United Healthcare, Cigna, and Aetna. Right? Those are kind of the big four, and the Blues are an association. They're not a single company, but it's generally kind of um, referred to that way. Sometimes they throw an H at the end for Humana, but um, all of these things are driving up costs one way or another. Um, and it is frankly a hot mess today, right? So the look of shock and horror on the guy with the pizza's face, Troy's face, is it speaks to a lot of employers, I believe, today, right? Speaks to, especially with everything going on right now.
I love it. Yep. Makes total sense, and I think, yeah, absolutely feels very real and relatable. Also a favorite show of mine, and the 7 season movies, I can tell you're a big fan. Yeah, that's awesome. Really, really cool, but also speaking some real truths.
The memes are, I love a good meme game,
Mhm.
and I'm envious of people that can pour their heart and soul into it. I you know I believe memes are going to be replaced by AI. I
Mhm.
mean, it's probably already. I'm probably. I mean, I'm middle aged now. It probably already happened. I'm just catching up, right? But so I just kind of started stumbling into AI video, and I was playing around with Sora last night, and I was thinking about like how would I apply my fledgling meme game to this new thing, and it's super fun. It's a great way to kill a lot of time. So I put in a couple of videos that I slapped together last night. I think are that also speak to me. and are fun. And yeah, let's show the first one.
Here you go. You only get to keep a little bit. We need some of the money to go to the providers.
I'm the provider now.
So that video I sent to a few of my friends that work at United Healthcare. And I would say, Tucker, if I ever am going to teach a class one day when I got a little more gray hair, this is one of the concepts that you would teach in a history class of American healthcare. So it actually goes back a while now to the Affordable Care Act. So the Affordable Care Act introduced kind of rules around medical loss ratios, and the theory back then was to limit how much of the premiums that are being collected by the insurance companies are used for overhead and profits. So driving more dollars into paying providers. And the idea was that would kind of clean up the inefficiencies in premium management. One of the byproducts was that it just had the insurance companies move up and down in the supply chain. So then the insurance companies, they're capped on how much they can keep of the premium, and they have to pay the providers. They started buying the providers. So now they're just using that other 80% of the premium, and they're kind of redirecting some of that spend to themselves as the providers. So it was an unfortunate, depending on your point of view, byproduct of one of the ideas from the Affordable Care Act. And it's just kind of funny. It's happening a lot with very similar type of parallels in the pharmacy space, with PBMs buying pharmacies and pharmacy companies buying drug manufacturings for like biosimilars and things like that. So if you restrict someone's behavior on one piece of the supply chain, they're just kind of reallocating some of their location to other parts so they can capture more of the profits in the system. And that creates kind of some interesting perversion of the incentives that are going on.
Yeah, I think that's a good way to put it. And that's interesting. You mentioned even the PBM space. I remember, I think Don Anderson saying something, how he would talk about kind of the fox guarding the hen house. And yeah, you've got kind of this profit consolidation, and then as your video illustrated, kind of some sketchy behavior going on that doesn't always help the little guy. So really interesting. I think you had another video, Steve, that we could watch as well. Let's roll that one.
It's lined up, bro.
Clamp it.
Yes, let's go! Lock it in, baby. Easy money. Easy. Oh, no! Are you kidding me, bro? What?
There's a lot of that renew their policies on January 1st. So, we're recording this kind of end of October. There's a lot of this going on. So I would say if this is how you feel about your renewal, you probably need to adjust some things, right? So, talk to your consultant, get a new consultant, get more active in your plan, like just kind of hoping and praying and kind of the low odds of the claw game, trying to get a better renewal. I empathize. There's a lot of that going on in the marketplace. I know there are, I think the average is like 9-10% average renewal increase out west. It's tough, and someone's going to have to shoulder that, either the employer or the employees, and that's not going to be good for anybody. One of the things I'm proud of is on the Western grower side. I think we're averaging less than a 2% renewal for 1/1, and I would love to take all the credit for that, but I can't. We have really good collaboration partnership with our broker partners and employers, and all these things we're doing, driving more efficiency into the system. I kind of, it's not lost on me that it requires engagement and having partners that are going to help communicate the message and kind of drive that efficiency in. So that video is kind of like it's very, very timely right now. I like that one. The third one, the last one I made, that one is another one that I think will resonate more with the actual people on the plans. Can we play that one?
This is not helping at all. What was I thinking? Look at this thing. It's ridiculous. Yeah, I'm soaked. Completely soaked.
I know a lot of people feel that way about health insurance. you have really expensive premiums and then very high deductibles and out-of-pocket maxes. So you're paying a lot of money for that umbrella, and it's not really doing anything for you. That's kind of where a lot of people on these high deductible plans feel. And when it's raining, it's kind of not working for them. And I empathize, and I would argue, let's collaborate together and find a better way to get a real umbrella for you. You know, it's but I think that one will really speak to people, not only in the group health market, but in the individual market as well. Like that's a kind of universal feeling, I think, with everything going on in the markets today.
Yep, absolutely. Yeah. Paying a lot and not really getting anything for it, or feeling like you're really not getting covered, literally. So I love that. Well, thank you, Stephen. Thank you for bringing these kind of creative approaches, and even showing us what the power of AI can do to help us illustrate some of the woes, but then also talking through some potential paths forward. Awesome. Yeah. And thank you so much, Steve, overall. I think this was an amazing conversation. You helped us look kind of ahead at where the state of healthcare is and where it might be going, but then also a lot of different possible ways forward to help employers and brokers alike think through ways that they can start to maybe architect a better future for their employees, for their companies, for their business. So yeah, it's just a delight to talk to you. Thank you very much, Steve.
Thanks, Tucker. Always great to talk to you. And if I can help anybody, we'd love to. And if we're not the right solution, we'll definitely let you know, and we'll kind of steer in the right direction.